All righty. Good afternoon, Commissioners, and over to you, Chair Harrington.
Good afternoon, everyone, and welcome to the Tuesday, October 28th, 2025 Board of Commissioners, Board of Directors work session. This is Chair Catherine Harrington. I am here with the full complement of District Commissioners. District 1, Commissioner Nafisa Fai, District 2, Commissioner Pam Treese, District 3, Commissioner Jason Snyder, and District 4, Commissioner Jerry Willey. We're all having fun watching the World Series and conversing about respective teams. And speaking of sports fans, I just want to share, if you haven't heard already, that County Administrator Tanya Angie gave her final address as the president of the International County City Managers Association, ICMA, down in Tampa, Florida. And she received a standing ovation for her address. So we wish her and all of the members down in Tampa continued good luck in the remainder of their conference and wish them all well getting home with their flights. So we have a couple agenda changes for this afternoon. We have an updated letter that we'll get to under topic 3. And topic 4 has been canceled. We will not be having any executive sessions today. So we may just get through 1, 2, and 3 before we adjourn without a break. We'll see. So first up, we have consideration of amendments to the bylaws for the County Aging and Veteran Services Advisory Council. Welcome.
Well, thank you so much. Good afternoon, Chair Harrington, members of the board. My name is Mira Samantel. I'm the Director of Health and Human Services. I use she, her pronouns. I'm really pleased to welcome back before you today Rebecca Miller, who is our Program Supervisor with Disability, Aging, and Veteran Services, who will take you through today's presentation. Before we get started, I just wanted to acknowledge one correction on the agenda item. It says we're returning to your board with an action item on December 9th. It's actually posed to be a consent item for your consideration. So my apologies, and we're correcting that to be a consent item. And I'll turn it over to Rebecca.
Hello, good afternoon. Rebecca Miller. I use she, her pronouns, and I'm the supervisor for Disability, Aging, and Veteran Services. And Disability, Aging, and Veteran Services is the federally designated area agency on aging. I like to always just remind you of that. And I can go to the next slide. There we go. So today I'm going to just talk a little bit about Aging and Veteran Services Advisory Council, which, if it's okay, I'll refer to as AVSAC. I'll go over the bylaws history and updates briefly, talk about our process for how we got to the amended documents, and address any of your questions. So a little bit about the advisory council. So it is a 19-member council that is structured to advise our division and enhance our leadership role as the area agency on aging. We have 13 regular members and 6 alternate or non-voting members. Membership is described on the slide here, and really what I want to say about that is it really is pretty much cut and paste from the Older Americans Act. So this is the shorthand version, but it's fully described in the bylaws document. The Older Americans Act requires each AAA area agency on aging to have a senior advisory council, and it defines the greatest economic and greatest social need in the act. And then the state unit on aging, who's our funder, where the funds pass through, further defines that. And then we, as the local area agency on aging, can even fine tune it even more. It's based on a community needs assessment we conduct every 4 years. We came to this board earlier this year, I guess it was in 24, as we completed in the summer of 24. So that's how we define greatest economic and social need, in case you're wondering. And again, Older Americans Act is where we get those rules from. So the last board approved update was in 2019 when Mira was in the seat. As mentioned previously, the OAA, Older Americans Act, guides our area agency on aging in the workings of the advisory council. And the OAA was, new rules were promulgated in 2024, and they need to be implemented by this month, October 2025. So in anticipation of that, we began in the summer of 24 to bring that idea to our advisory council, and started asking them if they'd like to form a work group, which they did. So we've met several times over the past year. While together, we also took the time to create a document that outlines really member expectations, code of conduct, and things like that. So I did include that document in your packet for reference. Because it's included by reference in the actual bylaws, we won't come to the board if we need to make small amendments to that. So instead, those will be adjusted by ABSAC, be reviewed by leadership, and then county council. So just to give you an idea on the process there. So the updates we made were, again, to reflect the changes to the Older Americans Act rule, which really gave us a lot more clarity about what the role and scope of the members should be under advisory council, according to that Older Americans Act. And it also talked a lot more about conflict of interest, which is a new clarified policies coming out in the Older Americans Act, and the State Unit on Aging is working on that. So again, that will get updated in our member code of conduct, and be reflective and in alignment with county policy on that as well. So the other thing that we did in the bylaws that's significant is increase the visibility and clarity for veterans involvement. So the Older Americans Act is kind of why we have a senior advisory council, but we had veterans on our committee who felt it was important to understand the role of veterans on the committee and how that work was reflected. So they really advocated for more visibility in the bylaws and inclusion and clarity around their role. So in Article 3, under Purpose and Function, Section 2, and Article 4, Section 1, Paragraph 3, in the bylaws, you can see where we clarified that. So nothing that takes us out of scope, but really does give us some guidance as we move forward and really codifies it to live beyond me or anyone else on the council. And then the overall document was reworked quite significantly. If you looked at the track changes, probably hard to follow. So it just is a much more streamlined. And so we added the clarity as outlined on the bottom bullet point there. Let's see, keep going. So the process, I said, we formed a work group to help us through this. County council also attended an advisory council during the revision process to give guidance to our members. And then we provided regular updates between July 24 and September 25. The ABSAC, or Advisory Council, reviewed and discussed the bylaws during the July meeting and then voted in September to bring them before this board. County Council has reviewed and approved the bylaws as well. So I did submit 3 documents for your review: the new version of the bylaws, the track changes document, and then those member expectation, conduct, and ethics is the title of that. And before I move to the next slide and open for questions, I just wanted to thank our ABSAC members, Matthew King, Vicki Wolf, and Robert Roden, for the extra time they spent on this, particularly Robert. He and I wrangled over the veterans language, and he's just a great advocate, and I think we landed on a really good spot. And then Sandra, who's in the back. Sandra is our liaison to ABSAC, and I want to give her a shout out for all her work on continuing to move the work forward, and she did a lot of editing on the document, so big thanks to her for her efforts. And with that, I would like to see if you have any questions before this comes on your consent agenda on November 9th. Oh, it is December.
It is December.
Wow.
Due to board scheduling.
Already?
Sorry, all these days. Commissioners.
I don't have any questions, but this was a significant undertaking, and so I applaud you and all your volunteers that went through this. This was a big deal.
I'd just like to say congratulations. I know what it's like to review bylaws. It's really hard, and but it's so important to keep it up to date. So thank you.
I appreciate the element that you were describing of listening to the feedback from that particular veteran member that you were describing, and the advocacy that they provided, and that you worked to try to make that happen. I mean, this is government being responsive to the feedback that it's getting, and I just am always looking for those moments to make sure they're happening. So thank you.
Thank you, Rebecca, for your presentation, Amir. I appreciate you using not a red color. Um, it would have been overwhelming, so thank you. So that was greatly appreciated in terms of my reading. And then the other thing, the only thing that caught my attention that I was wondering if you could shine a light on is in terms of work plans, what does more visibility mean?
Yeah. Well, I think in the structure, we do an area plan every 4 years, and then we update it each year. And we include veterans as one of the issue areas or focus areas, but that's not a requirement according to the state unit on aging that gives us our directive on that. But by including it in the bylaws, I think it really helps kind of cement that as something that we would continue to do. And then it also we clarify that a veteran would always have a position called out as opposed to being a member of just the general public. So I think that's one of the ways. And then it also just clarifies how our advisory council members would work with our staff in terms of what they can influence and what that looks like.
Okay, thank you. I was hoping to hear something more like we're going to do some innovative stuff with our veterans and aging people, and what this paperwork led me is to try to Google the American Act and to try to see what different counties are doing, the older American Act, and how they're implementing. And I saw some innovative, but I'll send it to you.
Great. Thank you.
So I go sweep. I have a couple of questions, but all my questions go towards context. I'm 100% thumbs up and appreciative of the work that has gone into this update. But I want to make sure, especially since it's on the consent agenda, to make sure that in accompanying slides, in like the topic sheet, that it's really clear. So what I'm looking at is summary of the topic. In the second paragraph, you talk about the requested amendments aligned to the new rules promulgated by the Administration for Community Living.
Mhm.
Is that federal or state?
Sorry, that's federal.
Yeah.
Mhm.
I think if you insert that word,
Okay.
that'd be really good, which really led me to my second question. We don't pick our population, right? We have our population. We're gifted population, births, deaths, people growing up here. It's a beautiful thing. And we are a government, right? A local county government in service to our community. And as one of the elected leaders, boy, we are so fortunate to have the public servants working here at Washington County in service to our community. And here we are in the 2020s, interesting, challenging, and different though they may be. So, you know, we have things like the Older American Act, one of the many sort of pillars of our government. And I appreciate how in your presentation, you've talked about the act really being a foundational thing, how the rules have been updated, and the great review that you've gone through. I'm curious a little bit if sometimes it helps me to get a reminder on our state context. We know the whole time I've been an elected official, the population in Oregon has been getting older. Is all of Oregon covered by these area agencies on aging, disability, aging, and veteran services? Are we unique in that ours is within one county? Compared to the 36 others? You know, various just specific questions come to mind, but I'm looking forward to your giving me the context within the state. Is there any portion of the state that isn't covered by one of these areas? And is it because of the nature of our population size and whatnot, that we get to be one of these just as a geographic county. Could you tell us more about that?
Yeah, sure.
So we appreciate what we've got.
Yeah, so there are 16 area agencies on aging. We happen to be a single county planning service area, as they're called, or PSA. There's one state unit on aging in every state, and then they are the ones that work to designate with their federal partners. So they are beholden to the Administration for Community Living, whatever their name shall be, eventually. And then we work with them to do that designation. Our like funding distribution and what that looks like is done. There's an intrastate funding formula that they have to get approval from the feds for. So that's how it's determined. So Washington County is single county, Multnomah County, Clackamas County, you start getting east and there's 5, 6 counties. In terms of the services we must provide, that's determined by the Older Americans Act, and that you will find the same as an option, but how we do it, it differs by the planning service area, and there's local control based on the community that you have.
Yeah.
So a lot of the hallmark of the Area Agency on Aging is local determination.
Excellent description, Rebecca. And I think just in addition, as Rebecca highlighted, in Washington County, what's unique is in our advisory council, we've added veteran services. So that does look unique in across different area agencies on aging. That's not part of the Older Americans Act. That's separate funding that we receive. The way we're structured in Health and Human Services is Disability, Aging, and Veteran Services is structured as a division. They have veteran services, as you'll see in the budget and you're well familiar with, and then they have aging services. So 2 separate funding streams, 2 totally different sets of requirements, but to benefit our community. And because we have that unique local ability through our area plan that your board recently adopted, as Rebecca mentioned, we are addressing the unique needs of our veterans as part of our advisory council. Although we're not required to do so, we have chosen to do so as identified by our community needs assessment. Thank you.
You know, I'm just on this kick, and I'm going to remain on making it as easy as possible for whoever's sitting in these seats to understand it as clearly and crisply as you've all presented here today, and for that clear and crispness to be present on our website through our budget document and whatnot. I think it provides a tremendous anchor for all of us to appreciate the good work that's going on in service to our community. So thank you very much for bringing it all to life today.
Thank you, Chair. And as we mentioned, veterans, if it's okay, if the Chair and the board are okay, Rebecca does have some leave behinds for our upcoming veterans stand down. If she could leave it with the board clerk, or we can also just hand them around.
That'd be great.
Okay.
Thank you.
Thanks.
Terrific. And onward we go to Deflection. More about helping the people who are here in our community.
Okay, good afternoon, Chair Harrington. I'm going to kick this off. I'm, as you all know, but for the public, my name's Marnie Kyle. I'm one of the ACAs, and I'm thrilled to be here with also Aaron Calvert, the other ACA, to introduce this Deflection update. As you are aware, this fledgling program was just recently, in September, just recently turned 1 year old. In just a year's time, we have designed, launched, learned, and made adjustments to this cross-departmental program that supports those with addictions by offering an alternative path out of the criminal justice system and into treatment and support. The program approaches serving those with addiction with compassion and clinical support they need to overcome addiction, also balanced with accountability. Today's staff will review the program goals, accomplishments, learning to date, and adjustments to who and how we serve. With that, I'll turn the presentation over to Danielle Farr, the Deflection Program Coordinator, and Eva Haas, the Research and Evaluation Analyst that's within the HHS Director's Office.
We have to start you off on a super high note. Not only is it the program's first birthday, but do you feel your sense of accomplishment?
Thank you.
It's huge.
It might be one of the most things I've been excited about in my lifetime. I think it's an honor to be a part of this work, to work with this kind of a team, and to be surrounded by that kind of support. So I appreciate that. It's been a tremendous and challenging year, but it has been a real pleasure to be a part of something that's so important to me and the people that have been a part of it. Thank you.
And another fabulous, exciting event in your life might have been.
And this Thursday, we welcomed my second grandson, born on Thursday. 9 pounds, 7 ounces, Philip Michael. So I'm a little bit
She's riding
deviated in my
high,
focus.
folks.
So it's been a wonderful thing for me and my family.
That's great. That's great. Well, welcome. I just wanted to make sure all team members with Deflection know you have absolutely delivered, and we're all on a high for you.
I had no idea you were a grandmother.
This is my second.
Second time. Wow. Congratulations.
Well, thank you. Thank you very much. Thank you, Marnie. And Chair Harrington, members of your board. My name is Danielle Farr. For the record, I'm pleased to be here to provide this update following our first year serving our community. Today, I always love it when it works. Today, we will briefly review our program. In addition to how we serve our participants, we will also showcase who we're serving, our partnerships, and how this work is currently being funded. We also have some early insight into our expectation for expansions and would love to share our continued enthusiasm with your board. A brief look back in 2024, Oregon lawmakers introduced House Bill 4002 and 5204, and those were a modification of the rollback to Measure 110 that recriminalized small amounts of substances, and that occurred back in 2020. The 110 that occurred back in 2020. Deflection was identified as a portion of that greater set of pathways intended to serve as an alternative to criminal justice involvement for possession of small amounts of those substances. The plan required collaboration between law enforcement agencies, district attorneys, and behavioral health entities to make sure that people with substance use disorder get access to care. Each county was tasked with designing a program unique to its county's needs. So there was limited framework, limited direction, and a whole lot of autonomy to be able to go and find out how and who we could serve. Whoa.
How enthusiastic it is.
So much enthusiasm. Okay. So the specifics of our deflection program were carefully and thoughtfully considered by various disciplines represented in our planning and implementation team. The team reached consensus on these elements, which honored our one Washington County approach. And as referenced on the slide, you'll see that that's county behavioral health, our DA's office, our sheriff's office, community corrections. Everybody is at the table with this consensus model. And we're pleased to report that this partnership has been tremendously fruitful and has served our participants well in fostering cooperation and consensus within the system and using the wisdom and investment of those involved to make more accessible and supportive pathway to care. So this consensus model has helped us to craft our eligibility and the other program criteria with a focus on starting small and growing thoughtfully. Through this collaborative work, we've had a series of expansions throughout the year. Those are expansions on our FTA grace period, widening that window, allowing some individuals who miss court the opportunity to still access the program. We've also had 2 expansions on our charges eligibility. And we've continued to widen that gate of program eligibility to ensure that we're maximizing the number of people we serve. We now offer folks with PCSU, which was where we started, and PCSA, which is a slightly larger amount. in addition to some co-charges, which when we started, that was not on the table. So some smaller co-charges.
So wait a minute, are you saying who's eligible is a bit more expanded then?
Yes.
Not what's listed here then?
No, it's what's listed.
So it's still what's listed here, the PCSU and the PCSA, but there used to be some ineligibilities if you had certain co-charges. Now we've removed that criteria and some co-charges, not all, but some co-charges are allowed. And those include theft 3 when there's no restitution, criminal trespass 1 and 2, and disorderly conduct 2. The thought behind that is sometimes the intervention that brings law enforcement or public safety to the interaction, and then the substance is found, it would be unwise to have that initial encounter disqualify them from the opportunity to serve. So in partnership with our DA, those recommendations were made and we were able to expand that.
Self-defeating for the whole program.
Go after the root cause.
And there are still some programs that have just stayed with PCSU only because they want to be really specific and really careful and leave that a narrow gate. But it's always been our intention to expand services as long as we're making sure to serve carefully and thoughtfully. One of the known challenges in having a deflection program is having varied jurisdictions and departments all working together on a shared goal of community care and safety. This slide shows our participation by police departments and public safety partners. So the larger the box, the more citations were made. And it is important to note that these are citations, not necessarily individuals, and that can vary quite dramatically. So this shows just kind of the lay of the land of which, I guess, pitches are being thrown across the plate for this specific officer intervention model.
I was a little surprised to see Sherwood as expansive as it is, and Tiger doesn't show up at all.
Neither does Walt, I don't think.
So I thought that was interesting. But Sherwood seemed a little outsized to me. Yeah.
One of the notes that was brought up in the early efforts of design is that law enforcement partnership is a relationship just like any other. And we believe that this public safety investment that you're seeing there is directly related to the strong efforts from Lieutenant Knopfsinger, and he's been our liaison in the Sheriff's Department. He's had active communication every time we've had an expansion and change. He's put out another training so that people stay up to date. They don't feel like there's a constant jarring change, and then they can feel like they're a partner in this. And he really has been. And I think his support, encouragement, recommendations to our public safety partners have really kept them feeling like they're a part of this solution, which I think has helped to encourage the engagement where you're seeing it.
Yeah, without the citation, we're left with nothing. Yeah, this is the necessary onboarding, right?
It's the initiation, right? It's the catalyst for this engagement.
Can you comment a little more about the lack of Tiger to Walt and engagement here?
I don't know that I have specific information on which outreach or what that relationship is on the Tiger to Walt engagement.
It's just pretty stark in the data. Okay.
Yes.
I was going to bring this up at the end. So if you want me to wait till the end, I certainly would love to have this. I'd like to follow up a little bit more with that.
We can talk at the end.
Yeah. I will leave that up to you to decide.
Go ahead and finish up your presentation there.
Thank you, Commissioner Wiley. So since September 1st to October 9th of this year, we had 177 eligible for the program. We've served over 105 people in deflection. This means that 105 people had the opportunity to receive a personal community-based liaison invested in their recovery needs. and ready to support their recovery goals. And up here you'll see our successful completions. It means that 24 people have not had to see the inside of a courtroom. They haven't had to be on a wait list for a district attorney or a defense attorney. We've also listed the number of people who were exited that were not able to complete. And I think you had asked about this last time, Commissioner Willie, that just because they exited doesn't mean they didn't receive services. Many of these people still engaged in treatment. They still were able to get food boxes, resources, assistance with health insurance, but they didn't meet the totality of the completion requirements before that 6-month period. They still get the opportunity to go through conditional discharge on most occasions, where they still have that opportunity to relieve the charge from their record and have that expungement. So they still get a different, more formal version of support through our community corrections. We've continued to see our numbers climb much more rapidly at each of these expansions and education times. We've also sought to invest in thoughtful growth by collecting data to gain a deeper understanding of how we can provide this specialty coordination.
Thanks, Danielle. And good afternoon, Chair Harrington and members of your board. My name is Eva Hawes. I am a research and evaluation analyst in our Department of Health and Human Services Director's Office. One aspect of my role there is to provide evaluation support for many of our programs. And so that in that capacity, I'm speaking to you as our program evaluator and data lead on our One Washington County Deflection project. So we want to share a little bit more about the community we're serving in Deflection. As Danielle's been speaking to, people served through Deflection often impact our systems or interact with our systems in some ways, but it's not necessarily in a really wraparound way. So we want to move forward, right, with the goal of Deflection is really serving the whole person in an individualized way. So to begin, I want to start talking us through some of our demographics of our participants. So what you see here is a chart that reflects Washington County population of adults, so 18 and over, and our Deflection participants. The first bar, that blue bar, is our 18 plus population size, and the red bar is our participants in Deflection. So a couple of things to note before we start talking about these is one, these are not mutually exclusive categories, meaning folks could belong in more than one category and often do. So you could be a person who identifies as white and Hispanic, for example. These are also self-reported. So we ask participants how they wish to be identified and categorized. So we're not making sure that that's reflective of how they would wish to be identified. And we look at these data primarily to make sure that we're not seeing evidence of disproportionality, right? So we're serving one population group more than we might expect to based on the underlying population size. With the caveat that we do still have small counts. So as Danielle was talking about, this is representative of about 100 people. These data go to 9/1. So it's one full year of program data, which means in some of our smaller population groups, for example, American Indian Alaska Native, Middle Eastern North African, or Native Hawaiian Pacific Islander, any one number in that might increase that proportion pretty disproportionately. So I just want to caution you of those interpretations. Those may look larger than they might really are. So as our program expands and we have more people in those population groups, they'll be a little more stable. Okay.
Would a head count be a better reference than 8% then in that case?
It depends. I think I chose population proportion to protect some identification here, since we have small counts and we want someone to feel identified by seeing a number on the screen. But there are many different schools of thought of how to present those data. Great question. One other quick note is you'll see the asterisk on the screen. Middle Eastern North African is not currently a population group that's measured in the census. However, on the next iteration of the census, that will be a category. So we'll be able to have a underlying population comparison. Okay. So we also do have two deflection participants who declined to provide their information, which is completely appropriate and acceptable. All of these questions are optional, and people can still enroll in the program and continue through if they wish to not disclose. So what I want you to see from these is that we're encouraged to see that the population we're serving is roughly reflective of our population, and we don't see evidence at this point of any disproportionality. However, with the caveat that these are folks who are enrolled. So we have provided an intake, we've provided some level of service, they've disclosed to us. For people who are cited and then not enrolled, we of course don't have as much information on those folks. Okay, so Danielle spoke to the multidisciplinary nature of deflection, and which is really critical to serve this underlying population. I wanted to give you a little more about who we're actually serving and who is coming through the doors proverbially with deflection. We know that this program needs to be adaptive for each person's unique circumstance and each person's unique complex needs and life experiences. This is a population that's often really hard to reach, has really lots of needs that need to be considered. And so we wanted to just describe some of those characteristics. 1 in 10 of the folks we're working with in deflection are uninsured. The largest insurance provider at this point is Medicaid or Oregon Health Plan. And that's 73% of our participants are covered by Oregon Health Plan. 3 and 4 are unemployed. Spanish is the preferred language of 8%. We've also served folks in Somali, German, and Arabic over the last year. Almost 1 in 3, so 29% of folks we're serving have experienced some sort of disability, which is roughly more than double the general population of Washington County, which is about 12% of people experience some sort of disability.
That's a mental disability or is that a physical?
This is any sort of disability, but the most prevalent one is because of a physical, mental, or emotional condition, you have serious difficulty concentrating, remembering, or making decisions. Which is also the most prevalent disability type of the general population, but it's just a much lower person. And lastly, we wanted to illuminate that 3 and 4 of our participants are experiencing some sort of houselessness or homelessness, including staying with friends or family. So it's just not having a permanent personal residence. 1 in 3 are unsheltered upon starting deflection, or almost 1 in 3, 32%, which is living outside, right, in a tent, living in a vehicle, or some other place unfit for human habitation. And I'm going to repeat that. 1 in 3, right, 32% of our participants. Nearly 1 in 2, so 49%, have an unstable housing situation. So why do we share this? We really just want to underscore the complex needs folks have who are entering into this program. Many people have been struggling for a long, long time. We also, or it's really important to us to serve people in a trauma-informed way, right? Making sure that their care is individualized for their unique needs. It really underscores why our population needs to be served with so many different partners that Danielle's going to speak to just in a minute. And we really hope that this experience for them is able to support them in their path to be successful or on the path to recovery or finding a path to recovery. And also underscores why we think sustained engagement is really the best model.
Thank you, Eva. So with that varied and complex needs of our participants, this work would not happen without our community referral partners. So in addition to our regular multidisciplinary meetings and our daily huddles, weekly team meetings, and monthly leadership meetings, with those committed volunteers and contracted agencies, we have 25 referral partnerships, many of which offer a wide variety of services. And we're in discussions with 10 more, increasing our geographic reach and expanding our ability to serve those who have that private insurance. So what you see on this slide is the services, the partnership agreements we have with the number of people who provide those services. So we have substance use disorder outpatient, peer delivered services, mental health, residential services, and even primary care providers and withdrawal management.
Is not the number of people that have been served, though.
Correct.
Graph
This is the number of
needs-
providers.
yes, needs to be interpreted carefully.
Yeah, I had to read it twice too to get to the little footnote down at the bottom there.
The key at the bottom is a little small.
Number of partner
For us,
providers,
yes,
yes.
yeah.
So this variety of partners is perfect for the early place that we meet our people. In addition to the participants' needs for recovery service, there's also opportunities to offer connection to specific services unique to their needs. Our contracted peer case managers are doing outreach, providing peer supports, providing individualized care for all individuals. They're equipped with iPads to meet in the community, translators for the individual interaction, but even to foster family engagement, to make sure that we're inviting culturally competent care. And the spirit of Deflection really is to offer incentive and support to overcome those barriers to recovery. Of the over 400 referrals that have been provided thus far in our Deflection program, 70% of those have been confirmed as accessed services. A referral is provided and the service is received in over 70%, or in that 70% of cases. That means from outreach to initiation through engagement, we're meeting the needs of our participants.
So I just want to be clear, 30% not completed. That's not failure. That means like I'm an individual. You're giving me access to a spoonful of carrots or, sorry, very simple analogy, or applesauce or something. But I ultimately get to make the decision if I want to accept. So it's just 70% were accepted and utilized, and 30% were just declined.
Thank you, Chair Harrington. It's a really important clarification. It's even better than that. I've offered you a hamburger, a cheeseburger, and a hot dog, and you just picked the meal that you wanted the most and was the best for you that day. These ones end up being not completed, but you got fed. So it might be withdrawal management, residential, and a medication service. They're getting those.
So 100% selected something from the menu?
It does fall short of 100%, but 100% of all of our completions have completed an ASAM assessment. They've also not just accessed treatment services, but demonstrated sustained engagement in treatment services. So it's more than just got a contact. It's fulfilled some recovery goals. Yes.
Okay.
What's surprising to me on this slide is, given what we're talking about,
yes,
that the substance use disorder treatment services is at 63%. Is that surprising to you, troubling to you, or to the point made a moment ago, that's just not what is chosen off the menu? I'm not sure how to react to that, just given the nature of what we're talking about.
And I completely understand that. And again, it's a good clarification. So I think the 63% is less representative of people getting connected to treatment and more representative of the number of potential services out there. So many people are getting more than one treatment service referral and only selecting one or two of the 3 or 4 that they might receive. So it is not representative of people connected to services as much as it is that we are following through with the referrals that we're providing.
So they're choosing, for example, non-clinical recovery interventions. That's higher than the substance use disorder treatment services, which means more people selected that. I want to make sure I'm clear on what that means. That means more people selected that off the menu? No. Well,
and I think you're giving me good things to think about how I might remodel this in the future. But the non-clinical recovery interventions, that's peer supports, oftentimes are harm reduction supports. The opportunities for that are more limited. So if I refer you to peer supports and you get peer supports, that's a connection. If I refer someone to intensive outpatient services and medication services and detox services, and you get medication and outpatient, you're at 66%.
Got it.
So this is the
So
number.
this doesn't represent a single,
Category.
No,
yeah.
it's
Okay.
it's our actual rate of connection. And what we've found with because this is one of the things that CJC is tracking so heavily is, does this work, right? Are we just doing paperwork to cycle people through? Is this a light touch and a return to normalcy back into whatever started the process in the first place? Or are we actually connecting? Are we making that happen for folks? And what we're finding is our sustained engagement model means that we are connecting people with services. We are making those connections. It's not just a referral and a hope. Yes.
And that was, and we can answer this question at the end, but that was my question. It's like, where would we be without this? And I think you're getting there, that it's the sustained support that is the key here. Okay, and that didn't happen previously.
We weren't here a year ago. Yeah.
Well, it didn't happen in any other format either, is what I'm surmising that.
So through all this, what I'm getting out of it is there is a sustained engagement model, and we have a 70% rate of connection
To all
for the
referrals that
whole
we
suite.
provide.
This is representing the whole suite, but within certain types of there's some, like, what I'm trying to get at is treatment. There's the two categories sound like treatment. The third one on the top row, it's still recovery, but it doesn't have the same, I'm not thinking of the word treatment. They're still on that path. And you've opened my mind that maybe what these certain individuals needed was they needed the mental health support to stop using whatever they were using, or they needed the access support or other basic needs, which is not to say they wouldn't engage in the other types at some point, but those were critical connections.
Correct. And we can send you, maybe loop back around with something that's more in the weeds, because I can tell that the team is really interested in this. We were hoping to.
Well, I don't hear us trying to get into the weeds, but we're on the journey with you that this is still a new program. And I want to make sure that the people who serve on the CJC work group or whatever the state work group on, and then if AOC or LOC has something, that the level of description can come across to us in more of these layperson general terms versus you have to be a subject matter expert. We're trying to make sure that our general population has the opportunity of appreciating the value of this program for our communities. And I think across the board, we're really excited at how not only did you help us lean into this opportunity, but we're helping change these lives.
Well, I think just to follow along with your point there, it's also in our communication outside of this room. With the general public, they don't have nearly the understanding that we've been given from you. And so it's important that we at least have a basis of communication that we can tell them how well this program's moving.
Right.
Thank you.
Thank you.
Success has many looks. Success comes in many forms. That's the phrase I was looking for.
I mean, back to that slide, just to finish this thought or series of thoughts. The way I'm thinking about some of these categories is it doesn't, like, you described 3 or 4 different things that might fit in one of these categories, and they accepted 1 or 2 of those. Like, to me, what matters is that they accepted and completed one of those in that category. Like, to me, that's maybe the more meaningful number. I think this is a good metric to know that we're making meaningful referrals, but like from an outcome standpoint, whether someone completed intensive outpatient or some other thing that's in one of these categories that's in the same category, like they don't need to necessarily do both, right? So I like that 64% number, I don't think is reflective of how the system is doing for the humans.
Sure.
Does that make sense?
It does, and it gives me a better way of how we can reconceptualize this, and could even loop back around to give better reference points if you guys would like.
Yeah, it's like 30
by the person.
64% of our total available market wanted and needed that subcategory.
I can loop back around with some better details to make sure that you guys are seeing that 100% of the folks in our treatment or in our program are receiving a SUD referral.
1 or more, yeah.
Yeah, or more, right?
Yeah.
Some are getting 3 or 4 different referrals because they really don't know what's going to fit for them. So I think we can send some more information out.
Yeah. Is there another way to put it is the utilization rate of each of these types is as follows. Every single one of them is necessary as shown by these numbers.
I think sometimes the problem with data is how do you communicate what the data means?
Yeah.
And, when we're the experts looking at it, staring at it every day, we think, oh, we got it. But we're definitely hearing, and I think Danielle has said, we're hearing like this isn't as straightforward as we had hoped. So we will circle back and help establish a better, clear understanding of what this means and how it relates to the success of the program. So we'll definitely
Is there
get
a
back with
required
something.
number of referrals per person participant? The maximum referrals the county can make. I thought 400 referrals were provided, but
So this is detailed. So there's a certain subset of number of categories that OHSU is tracking. So it will only track 1 residential referral per person, but has a bunch of subcategories. So there is arguably a maximum, but I can loop back and
there's
see
a
what it might be.
graduation requirement.
Yes,
That's
for someone to
way to go.
For someone to complete services through Deflection, they need an ASAM assessment and they need to demonstrate sustained engagement in the deflection not in the deflection program, in their treatment program. And there needs to be a general understanding that if we step out, that they're expected to continue in services. And we establish that through the provider. So everybody's receiving that substance use disorder treatment. Everybody's receiving that ASAM. But because there's so many different kinds of substance use treatment, people will get more than one, oftentimes, as just part of their deflection program. Some folks will go to different treatments throughout the duration of their care.
But you're probably going to talk about this later on, but I see the percentages here, but I was hoping you could talk more about your own process improvements of how to raise these percentages so that people are, utilizing these services and maximizing the opportunity that exists.
Yes. Thank you.
Okay, thank you for that conversation. So we've talked through the program and who's being served and how they're being served. While we're really limited in our ability to draw a lot of conclusions after 1 year of data, specifically about the program's effectiveness and the system effectiveness. We do have some promising outcomes from participants that we wanted to share. Almost a third report this is their first time in some sort of substance use disorder treatment. 44% total have completed substance use disorder assessment. That's ASAM that Danielle was mentioning. And 5 of our 24 participants who came into the program unsheltered were sheltered, which is huge, right? When we think about hierarchy of needs, right? Maslow's hierarchy of needs, having that basic food, shelter, safety really is foundational to be able to then operate at the next level.
That also means, according to the previous slide, that there were 12 that weren't. If you the 3 out of 4 number and all that that we talked about. So do those 12 that aren't housed, do they continue to move through the process, even though they're unhoused?
Yes.
And unhoused is described in different ways. We talked about that.
That's right. Yes.
I think if I recall correctly, the unsheltered was about a third. It was a 32%. So
3 out of 4.
No, 1 in 3.
So
3 out of 4 were experiencing some sort of homelessness, which is a little bit of larger expansive category.
Versus unstable.
This one right here.
Okay. But the bottom bullet was 3 and 4 are experiencing some form of homelessness. That's where I did the math.
Yeah, no worries.
It sounds more like that's people experiencing housing insecurity. We don't really talk about it that way, but that's kind of what you're really indicating.
Correct.
Okay.
Yes. Yeah. So one thing we wanted to share, this word cloud that you see, this represents the participant voice. So we asked them how things are going for them in Deflection. So the larger the word, the more often that was mentioned in their responses. So you see words like here and support and recovery and help and change and better. So those are really powerful statements. It's really important for us as a trauma-informed program to incorporate participant voice as to the greatest extent possible. So we asked them what's going well, what could be improved within their experience through Deflection so far, and we monitor those data for any process or system improvements we can make within, of course, the scope of the program. So what we want you to take away from this is we're really creating a pathway for folks to engage in treatment, sometimes for the first time, and providing access to other supports that aid in success. Danielle spoke to the high level rate of completed referrals on our past slide, although it sounds like we could do a little dialing in to make that a little bit clearer, which we also know are an undercount, right? So we provide a lot of referrals. We don't always know if those are completed. Our systems aren't always the most perfect at interacting and telling us how people have succeeded with that referral or not. So we're really dependent on the participant telling us, yes, I received that. So we know that those are probably a significant undercount. So as our program continues into year 2, we're looking forward to continuing to monitor our program's effectiveness in both the short and long term and our participant outcomes. The program was designed right after reviewing multiple national models of other similar deflection and diversion programs. As we have more time, more participants will be able to better evaluate our local model. The Criminal Justice Coalition, so our funder, is also engaging in statewide program evaluation that we participate in. We're also in development of an annual report that we'll be sharing in the next couple of months. And one component we're particularly interested in looking at is cost-inclusive evaluation. Emerging and established evidence really supports the idea that these programs save the system quite a lot of money. We'd like to see what we can know within our program in Washington County. So as we will be able to also identify, hopefully, which interventions are working, right? What's the secret to making this work? Although, as we've talked about, right, these folks have complex needs that often don't look the same to each other. And so really picking one size fits all is not the right path here for recovery and addiction support. And that is clear from our state funder, from every other jurisdiction that's doing deflection. Everything looks slightly differently. which is great for local context and makes program evaluation a little bit tricky.
Can I give a shout out? When you talk about following up on costing, I want to bring voice to including the cost. It's not just all the services will have a cost to them generally in the cost accounting model. But there is a cost to, and I'm trying to figure out the right language, the folks who were eligible but did not pursue the program. I'm not remembering the right. And I want to make sure that that is part of the cost accounting. Because it isn't just about the cost of the number of people we served, right?
Yes.
The cost of the people we left behind, right? And the grand societal scheme is the cost that we had people who continued to use, the cost of people who overdosed, those lives lost, right? So anyway, rather than be a cynic about cost accounting, trying to figure out ways to put things on a more level playing field.
Thank you.
We've continued to see deflection as a unique intervention, and this program bears fruit. We offer a pathway to recovery where intervention alone and invitation alone to recovery may not have been sufficient. So here are some of those quotes, which the word cloud was brought from, and I just want to take a minute to read these. From the moment I arrived at 4D and into the transition to Solutions Group Northwest, I felt supported that both organizations have walked me through the process step by step. My mindset has drastically changed in a positive direction because of the programs that were offered to me through the Washington County Deflection Program. I do not regret what happened. I feel that the Washington County Deflection Program was the second chance I needed to make so many positive changes in my life. I plan to continue on this path. And from another participant, we have, I'm glad that I got deflection because I had tried treatment but was never successful. Ever since I got deflection in my life, I've been able to do outpatient treatment, and I'm really glad to be sober and happy. So due to this continued success, we look forward to expanding our reach where funding allows. So CJC, just to put it front and center, CJC is expected to continue to fund the cost of deflection. We're able to stay within budget, and we expect to continue to do so. Due to some late legislative changes resulting from HB 3069, specifically the -6 amendment, funding awards were delayed, and grant applications, while they've been completed, and the expected funding award was just shared with us last Tuesday. So even though we are operating within that grant cycle, we've just received the information this last Tuesday. So this has been a challenge for our program and expansion and development, but because we've had such great support within leadership and the team and the CJC as a partner, we've been able to manage to stay steady. The initial award, our last grant period award, was for a smaller time frame and was at $1,504,885. The new budget award is expected to be $3,153,187. They did give us a small amount to start with, and that was distributed this quarter. The remainder, which we just found out, will be distributed in January.
That's to cover what time period?
They also gave us a new grant time period, but it should be the 25, 26, and 27 period, but with an end date of the end of August instead. So it's just a bit more than 2 years.
August 27?
Yes, August 31st of 27.
The full biennium plus a month. 2 months.
2 months. Yes. So your math is correct as you jot down that this does end up being a bit of a cost reduction, even though costs have gone up.
You mean a grant reduction?
Correct. Sorry. Yes, a grant reduction. In our last presentation, we had alerted you to your board that during our ramp up, we were underspent on last year's award. This was not a unique problem across the state, and that partnership with the CJC allowed us and others to extend that spending deadline for all counties, allowing us to fully utilize our 24-25 funds, but very nearly fully utilize our 24-25 funds. We will have a meeting on the 31st, this Friday, with our executive leadership team to discuss our budget, to see what program challenges this might be, but we expect our program to be, while it may affect some of our expansion hopes, we do not anticipate a reduction in our current operations.
But I'll be clear, where I feel the program is more threatened is the state reducing funding for the burn network.
On the services.
The underlying services that this program is really reliant.
Yeah, we are in talks currently with our care coordination team to ensure that since most of our folks are OHP, and access to services is a critical part of our program, that we have some in our back pocket to make sure that we're really focused and really thoughtful about how to mitigate that gap.
Yep, I get it. Thanks for that, Ramona.
While this past year has been marked by change and growth, we are prepared to continue this trend as we look to our second year and strive to achieve our next goals, which we anticipate will significantly increase the number of people we serve in our program. We've identified opportunities to reach vulnerable individuals through expansions of our current programs. Things like jail inReach will help us to reduce the number of people not engaged during missed contact opportunities, primarily for folks who have been picked up on an FTA and are still within that grace period window, so they don't miss out on the opportunity to participate in deflection. Completions and service access are expected to increase through the offering of incentives through contingency management programs. We are also excited to announce that we'll begin offering preventative support to reduce criminal justice involvement through our expansion of a non-citation pathway. This pathway will allow individuals the opportunity to engage with deflection without requiring a citation as the initial step.
So supporting.
Yeah, that's what I was saying too.
Yeah.
That's what I was getting.
The deflection has 6 evidence-based pathways. The ones that we're going to be focused on are community referral, so they can go to any agency, burn network, provider, and we'll have partnerships with them to make sure that, yes, deflection, case management, specific supports. Yes. And as we grow who we serve, we'll continue to increase our partnerships and tools to improve how we serve.
I just want to state on the prior slide that I need follow-up from somebody because we've gotten some updates over the last couple of months. It had something to do with reduction in state funding, maybe around community corrections and so forth, where the jail inReach programs were eliminated, and now this talks about beginning. So my brain's got a little whiplash. So happy to do it offline.
Yeah, we'll get you something. I think you're thinking of some of the Care Oregon reductions had an impact
Bingo.
on
Yes, thank you.
the services that we provided in the jail, and so we'll get you that kind of update. It's hard to track everything.
Yeah.
My head swirls, so.
Thank you. Thank you. Back to the timeline.
Back to our timeline. So many of these changes and expansions are illustrated on this timeline, and this gives you a broader picture of how far we've come in just 1 year. And we've seen many exciting moments. We have our introduction of contingency management coming very soon. We have the supplies for this. We're working on policies and procedures. We're very nearly ready. And then the non-citation expansion expected in spring.
Can we look a little further ahead in terms of the timeline? And I'm making stuff up. You know what that means? Looking right at Aaron. She's making stuff up. Welcome to Aaron's world with Catherine. I'm imagining you'll be back this time next year with a second birthday or second year celebration. That's great. Is there something in between that, you know, the ACAs and Ms. Angie know, we love the different quarterly updates you give us by emails, memos, whatever. That's all good. But I'm not trying to add more work, but rather, you know, if you have to give CJC something or you just delivered some hunkin' wonderful shiny gift to CJC, you share that too. So I'm thinking, great, you've let us know you've got positive plans, you've got a great positive program. We're there, continue to fully support you. And as such, we're staying out of the way. See you again in a year, unless otherwise. And hopefully the state will keep paws off of that full biennium plus 2-month funding. Because if they don't, boy, am I going into mama bear mode. So
Tag that.
is that timeline picture good enough? It is for me, is what I'm getting at.
Thank you, Chair. I think that's a wonderful timeline. It sounds like the board would have an interest in hearing memos or updates on any newsworthy, anything that's coming out. But otherwise, we'll see you in a
You've done
year.
really well there to date. You've done really well. But the other thing I remind myself of right now is there's going to be that 2-year anniversary, but also that will be good data because it will be before the long session in early 20. Oh no, there's 26. No, 27. 6 is a short session, 7 is a long session. So yeah, it all works out well.
Can you comment briefly on exactly what is meant by contingency management in the slide?
Yes. My apologies. Yes, Commissioner Snyder. Contingency management is an evidence-based practice where incentives are provided for target behaviors. So the idea is instead of just threatening to kick people out of a program or providing these kind of negative consequences, you just provide incentives for those things that they've identified on their treatment plan that they want to complete.
Carrots instead of sticks.
Correct. So and then you get these
targeted at the individual in treatment.
Yes, and while many of these are going to be program specific, so they're expected to do these things anyways, they can also set some of those up for their own personal goals. So the idea is getting more opportunities to celebrate with our participants for the efforts that they're making. And we want to have as many celebrations as possible during this really hard work.
That'd be an example. Okay.
Yeah, we do this in the form of gift cards. So $25 gift cards within county policy. They can't be used to purchase drugs, alcohol, gambling. But it gives them an opportunity to kind of choose their reward. They can buy birthday presents for their kids or burritos. It's completely up to them.
Thank you. I guess I'll just say that's an odd way of describing that in my mind. Contingency management does not really connect for me, but maybe it's just.
That's fair. That's a
Is it a
industry
CJC
specific term.
definition or?
It's a national definition.
Oh, boy.
They call it
Earmark
contingency.
that.
What you just described, they call contingency management.
Yes.
So could you footnote that and give us on the slide, the general person's
That's a very
our definition?
yes.
It's positive behavior reinforcement through incentives.
That's it.
Thank you.
Yes, thank you.
I think on that, you need to have a dot for first year anniversary.
There were so many dots.
I know. Just a little smaller, scrunch them in a little bit, but anyway.
I had to put the word contingency management. There was no more room.
I
There
see.
you go. You had a question earlier, Commissioner Willie. Did we go over that?
No, I want to go back to Jason's comment and as
Can
well.
you remind me what it was?
Slide 7, it's on the deflection eligible crime citations in the county. And if I'm reading this thing correctly, 47% are coming from Hillsborough, then a lot are coming from Beaverton or coming from Washington County, and then it significantly drops off. And I'm wondering, is that possibly because of a distance, I guess? Are Tualatin, Tigard, Sherwood, they'd have to travel further with this to get into this program? Is that what it is, or is it they just haven't really adopted this?
What's the
process?
disparity, I think, is the question.
Yeah.
I think it's a great question, and it's one that we've asked throughout the development of our program. What I can say is the citation occurs locally, and then it's sent to our DA's office, and then we do the outreach. So the distance and location has nothing to do with it. This is just
Okay.
citations made. So while I don't believe I can give you a firm answer on what does cause the disparity, proximity is not something that we've thought of as a thing. But I can check with Lieutenant Knopfsinger and see if he can give some more updates on outreach efforts, engagement, things, or what
Or are
he
there
thinks.
other barriers that
Yeah.
Well, and
It seems like our city police departments haven't all embraced this program yet. Yeah.
I also would be curious if you looked at any citation, if there's jurisdictional size differences in the citation. And then I think also just their general sort of policing philosophy and efforts are probably different. So I don't know if it's, I don't know if it's a disparity or disproportionate. It is interesting that Tigard and Tualatin don't show up at all, but
well, that's the only way I'm concluding
yeah.
there's a disparity.
Right.
Tigard's the third largest city in the county. It
Yeah.
could be probably at least the size of Sherwood or more.
Yeah.
And in this report, and Walton at least has people in it. So I mean, King City has 3,500 residents, and they're in the report, and we have cities that are 20 times that size that are not. Something's going on there.
Yeah, no, I agree. I'm just thinking it would be worth looking at other citations too.
Well, Multnomah County has this program as well, right? So why do we include Portland Department Police Department?
Because part of Portland is in Washington County.
So that's okay. That's the proportion. Okay. That's Pam's neighborhood.
Yeah, you gotta ask her.
Yeah, it's a pretty bad neighborhood. So yeah, don't go there.
Stop doing drugs, Pam.
The only other comment I'd like to make is just around the amount, like the data that you presented about this, 75% of the individuals are unemployed, 75% of them have some kind of housing insecurity, and they have more than double the rate of disability in the county. And yet we have people successfully completing the program at the rate that they are, I think is remarkable. So I just want to, I think some may look at this and say, oh, that's, you've had a lot of people not successfully complete the program. I think when you overlay what you're starting with, the story is just very different. So I want to make that statement publicly.
And that everyone gets a touch along, or at least has some touches along the way.
So the quote from the Washington County Board of Commissioners: Congratulations to our team. This is remarkable.
It's been a joy. Thank you
Yeah.
very much.
Terrific. Well, keep up the good work. See you back here next year for sure. Okay, we're on to topic number 3. We're in our home stretch for our work session afternoon. Let's start with our formal agenda review. We have a meeting tonight that starts at 6:30. We have 4 items on the consent agenda, 1 presentation, 1 proclamation, 1 action item. Has anything changed with regard to our signups? We all look to be in bounds.
Yes, Chair Harrington, we just look like we have 1 on the phone tonight, 1 on Zoom, and 1 in person for the beginning of the meeting, and just 1 at the end of the meeting so far.
Yep.
We have.
Great.
Chair,
Things are out of bounds. I'll deal with that. Yep.
excuse me, I asked Philip to come down and just give you a heads up about, it's not necessarily a sign up for this evening, but some information that we're receiving about potential protests, just as an FYI.
My goodness, people are going to exercise their constitutional
Yes.
rights, freedom of speech. Yay, us. What have you got for us?
Yeah, so we understand that there could be a rally at 6:15, just on outside. I'm thinking, but I don't know that for a fact regarding ICE
Okay.
detainments that have occurred in the county.
Okay.
That could result in people, as you've experienced before, people coming to give communication during your meeting.
Great.
Yep.
That was all.
Just
Okay.
a heads up.
Yeah. Thank you very much. So occasionally when we have a work session that ends early, some of our commissioners go elsewhere, leave the building, and then come back for the 6:30 meeting. So just heads up, make sure you allow for time there. So, okay, so back to board and leadership communication. Why don't we go through leadership communication first?
Did we finish the formal agenda? I'm good with it.
Well, nobody said they had any
I
questions.
didn't know
so-
if we finished the bridge.
Okay, leadership communications. How about we do CWS first, Virg?
Sounds good. Good afternoon, CWS Board of Directors. Start off talking about our State of the Partnership. So last night was our inaugural State of the Partnership meeting. We started with the City of Forest Grove and our council and mayor. Thank you to Director Willie for joining us. Mayor Wetzel and the council were all very welcoming. The atmosphere was great. They had lots of good questions. I think we did a good job of really highlighting the projects that we're doing in the city of Forest Grove. Of course, Fernhill is always a fan favorite, so we were able to give some stats on just how many folks come and visit that and focus on some grants that we've partnershiped on. So it was a really good start. Start to the beginning of our State of the Partnership. We've got a couple more coming up next week. November 7th
And
work
Rick,
session.
just the emphasis, and we talked about this last night afterwards, but the emphasis that in the communication from Rick and Joe was the amount of investment that Clean Water is making in Forest Grove, and it was significant, and I think it was pretty eye opening.
Yeah,
most of the counselors.
I would agree with that. The work session on the 7th, we're making final preparations for that. Binders will be delivered tomorrow. Materials posted online tomorrow as well. And please note, we will deliver rolling agendas next week, just up to date. And our consultant from Blue Tiger Leadership, Michelle Rios, she'll be bringing materials on the 7th for your packet.
And to update the board, due to a likely all-member AOC meeting being scheduled 10 to 11, I've worked with the team so that we pause our CWS work session. They'll get us a conference room to go to, and we'll participate in that, and then go back to the CWS work session at 11.
Yep.
Stay tuned for details.
The last item was just on leaf disposal, so fall is definitely here. We felt it this weekend. Our 33rd annual leaf disposal and food drive kicked off on the 25th of October. It will continue through December 6th. Fallen leaves, of course, can block storm drains and cause all kinds of problems with localized flooding. So every year we collect around 3,000 cubic yards, about 300 dump loads of leaves that we turn into mulch. More information on the dates and locations are available on the website.
So for members like me, well, who have taken advantage of this in the past, I can take my leaves, put them in those brown craft bags and take them to one of these sites and you collect them. And the locations are at cleanwaterservices.org.
Yeah, great.
Yep.
Thank you.
It's a great program.
Thank you.
Thank you.
All right.
Washington County.
Rock, paper, scissors.
Okay. Chair, Commissioners, good afternoon. Just one update for you. On October 24th, Senior Assistant County Counsel Adriana Ortega represented Washington County at a hearing of the Civil Service Commission. As a result of her advocacy, the Commission upheld a layoff decision from the Department of Facilities, Fleets, and Parks by a vote of 4-0, finding the facilities followed the county's layoff policy in Section 14.2 of the county's personnel rules, and finding no violation of policy or law in the layoff process. This is an excellent example of how Ms. Ortega, as your HR attorney, continues to protect the county's interests and ensure our departmental clients can continue to make decisions necessary for the efficient administration of the county's government. That's all I have for you today.
Great. Thank you.
Okay, I have three quick things. So first, an election update. As of yesterday, October 27th, 55,265 voters had cast their ballots for the current election. That's about 14% of registered voters. There are still 7 days left before Election Day on November 4th. As a reminder, completed ballots must be postmarked by November 4th or turned in at one of the county's 21 official ballot drop sites by 8 p.m. that night on election night. Mailed ballots received after November 11th will not be accepted regardless of the postmark dates. So for everybody listening in the public, get those in the mail now. Voters can get more information by visiting Washco Votes, all one word, .org, or by calling 503-846-5800. Results for the November 4th election will be posted according to our normal schedule. November 4th, we'll post at 8 p.m., 10 p.m., and midnight, and then every Friday by 4 p.m. Until December 1st, when the final results are certified. So speaking of elections, we wanted to say thank you to staff and board members who have helped with our 50 presentations to CPOs, Rotary clubs, city council meetings, and other community events over the last several months, and 7 tabling events at farmers markets this fall. We completed the last tabling event last weekend, and a couple of you will know, in the wind and the rain. At those tabling events, we reached over 818 voters just in those events alone. In addition, WCCLS team members have talked to well over 10,000 community members about the levy at community events throughout the summer and fall. And the public safety departments also reached over 10,000 community members at their various events. So on to, and I wasn't sure if I was going to be before or after the board members, so I hope I'm not stealing too much of your thunder. But on to the Center for Addiction
Dispensation.
Center for Addiction Triage and Treatment, another major milestone. As I'm sure many of you will mention, we have the ceremonial ribbon cutting followed by a facility tour. The Beaverton Recovery Center is one of 2 locations for the county's new Center for Addiction Triage and Treatment. And I know all of you know this, but I wanted to share a little bit about it for any public that's listening. The county's vision for the CAT began to take shape in 2019. From the beginning, it was a community-driven project with more than 250 people providing input to ensure that CAT would work for our community. People who identified as having lived experience with substance use were involved in nearly every aspect of the project. All services at the Beaverton Recovery Center, which is located at 17911 Northwest Evergreen Place, will be provided by longtime county partner, well-established addiction provider, Coda Inc. When services are operational, 86 treatment beds will be available. This includes residential treatment, sobering, withdrawal management, and transitional services. The center is slated to officially open November 17th. It will serve adults ages 18 and older. Most of the referrals will come from hospitals and other service providers. However, individuals can request services themselves by contacting CODA. All services are voluntary, meaning that nobody can be held against their will. And as a reminder, the Hillsborough Recovery Center opened in June. It's located at 5250 Northeast Elam Young Parkway. It offers a variety of outpatient behavioral health services provided by Solutions Group Northwest, LifeWorks Northwest, the Peer Company, Project Homeless Connect, and soon Virginia Garcia Memorial Health Center will be at that center as well. So I just want to say thank you so much to all of you for your support for the last 5 years and for being ribbon cutting. It was a very special event. And that's all I have.
Great. Thank you, Marnie. And now for board communication. Who would like to go first?
I think you should go, Chair.
Okay. I'll be pretty brief.
We'll go backwards.
I'll leave you all to it with regard to the CAT opening. It's amazing. 5 years went like that. But huge accomplishment for the team and the community. It's just incredible and absolutely gorgeous. And I hope that we have the problem that we have more people utilizing it than we can keep up with. So I'll just leave it at that. I attended the Metro SHS Oversight Committee. Great work is happening. Our county is leading in doing an update to the local implementation plan. So there was a lot of interest there. The committee is is in the very early days of highlighting that there is a future policy choice, given that funding is limited, constrained. A policy choice of reducing shelters in order to increase the wage scale for the community partners who are operating and delivering the services. So we have no lack of opportunity for difficult decision. So other than that, that's it from me.
I'll go next.
Great.
So while we're talking about the CAT, I was thinking it would be great to have like a photo collage of where we were when we went to WACA, when it was, remember all the wires under the floors and above. Then when we went to Yahoo, we always talk about all the purple chairs. But do you remember and the purple table? And do you remember the kitchen, the industrial kitchen that was still there with the grease that they left right in the grease bin, as well as there must have been 50 to 75 cast iron frying pans. Remember all those hanging on the walls? So it really is a transformation that was so remarkable in so many ways, and the staff is just my hat is off. And I think about the advocacy work that we went through to get the money from the state, the cooperation with the cities for the opioid settlement. It's a very big deal. And it's just, I couldn't help but think about it all through the weekend, actually. So,
Well, and I did have the opportunity to see a couple of the Holst architects during the self-guided tour, and it was remarkable to me how they took various from the Yahoo acquisition and made them seem seamless.
oh yeah, the
And
design,
new
the interior design. Yeah.
Yeah, it was just, and the artwork is stunning.
It really is. So it just brings a smile to my face always. Last Wednesday, I met with OLCV at Laurel Files and a few constituents, Debbie Garman, Ann Shermer, Ruth Dallas, Ingrid Arnett, and they wanted to talk about climate, just have a discussion, and it was a good discussion. I had MPAC last week, and we reviewed the MTAC nominations. We got an update on future vision and that coordination strategy, or excuse me, on future vision. And then we had a discussion about the state mandated regional housing coordination strategy. And in that strategy, we do take exception to a couple pieces that talk about SHS funded issues that probably don't belong there, but belong in a longer term SHS strategy. I did bring those to light. Nicole Sting was with me, as well as Jessica from the Blazer game. So she was teamsing from the Blazer game. I did.
That's one
dedicated.
Washington County dedication for sure.
Yes. Then the next day I went to the HBA housing forecast event.
Oh.
Several of you went to that. It was very interesting, and you may want to provide more information. But the housing forecast, we're still in. I don't want to say the word the R word.
No, we're
still
in
in the
which I'm going to go back and reclaim some time because I forgot to mention that on the heels of that, good learning, I thought Dr. Mike Wilkerson from Eco Northwest did a nice job about urging us to shift our focus over to household formation and household sizing, as opposed to historically staying focused on population growth. Yesterday, I purposefully went to the Forest Grove Cornelius Chamber because they had the state economist there, and he did a marvelous job of presenting the most recent state economic forecast in layman terms. And once again, highlighting how we have slowing here in Oregon. There are absolutely no signs of recession, definitely signs of slowing, but he explained the 1% line, and every recession has come with a crossover to that line. And while we've trended down from 2 towards 1, we're not at 1. And because there's a downward self-fulfilling prophecy, making sure that we stay focused where we can. And he was very clear. He's an economist, so objective, doesn't speak to policy. So we'll leave all that up to our state legislatures and state government. But anyway, I used a little bit of her time, so we need to give her time back.
The other thing that came out of that housing forecast that struck me was the fact that across the country, we're expecting basically a zero population growth. And many of you don't remember this, you probably do, but when I was in college, there was a whole movement towards ZPG, which was zero population growth, and you were about 2 children per family and that type of thing. So anyways, and it's here and we're not happy about it now. So there you go. On Thursday evening, I went out to the Kenton Grange near Sherwood. That's the coolest place. It's an old building. And I attended the joint CPO's levy briefing. Thank you to the CPO 10 chair, Andy Hagen. He did a great job of hosting. It was a good conversation, and it was great to be there once again with Lisa Tattersall and with Chief Deputy Jim Wheaton. They do a great job on both levies. Then the next morning, I went to another levies briefing at the Tualatin Chamber of Commerce, but that focused on public safety. And then Saturday was at the Beaverton Farmers Market with several of you that still might be a little wet from that event. It was Lisa with her giant
Pacho?
poncho. I was going to call it a tarp, which isn't very flattering. The poncho, and she had a clicker, and every time Catherine would talk to somebody, or Philip would talk to somebody, or I would, she'd be going click, 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 click. So it was great.
2,000 people.
Yeah, that's right. That's right. So on let's see, talked about Beaverton. And then Thursday, I'm looking forward to attending our annual housing forum. And it's just such a great event that the housing team is putting together. I just want to give a shout out there.
Oh, and thank you for reminding me of our afternoon roundtable.
Yep. On that same day, we have a roundtable. That's what it says next.
And then Halloween the next day.
Yes.
I'm anxious to see what Ms. Angie comes as.
And
her costume.
right. Oh my God.
I'll be coming as Catherine.
So on Friday, I'm meeting with a few constituents from Oak Hills, Megan Hill, Aaron Krug, Dave Ogle, to discuss the Cornell Road Transitional Housing Project. And Maida has shared that information with Grace so that you have it as well.
I saw it on the external calendar. I just don't know when it is yet. So, yeah.
So that's
Well, that takes up our time.
oh.
Yes, brother Jerry.
Saying between the two of you. Anyway, so I went with I had some coffee with Banks Mayor Marcia Kirk, and I starting to do that about every couple of weeks because they have lots of stuff going on in Banks. Most most difficult is that there's a rail line, of course, that goes through the middle of Banks. Two rail lines actually. And since Hampton is gone, the railroad has decided to park cars there. So their city is completely split in half from the golf course side of it, of course, to the other side, the west side of it, by real cars. So yeah, it's not very pretty.
Like storing them?
Yeah, they're just parking them there, solid, all the way from
across the
all the way
right
Hampton
away?
to underneath 6.
The roads are open, obviously.
Well, the roads are open, but I mean, yeah, it's not very pretty.
Feels like a barrier.
And I also met with North Plains Mayor Pro Tem Aaron Dumbro, and I think he's going to be appointed mayor, and then they still have 2 council positions open, so they've still got a lot of work to do. So we had a good conversation about that. Also attended the 26th Annual Home Building Association Housing Forecast. That was also, I completely agree with you, lots of good information in there. Probably the biggest number that I heard was the 18,000 jobs lost in the Tri-County area, 10,000 alone in Multnomah County. So that's a number. Yep, the CAT was a great fun day, and you could just see Kirsten and Nick just almost like take a breath, say, "Shoo, we got this across the line." But it was great. It was very, very. They did a great job. So on Saturday, I sat on an elected officials panel discussion with the Washington County Chamber Candidate Training Academy with Mayor Beach.
Can I pause for 1 second?
Mhm.
Senator Lieber talked about needing the recipe so that this can be replicated elsewhere in the state. And so it just struck me to ask the question, does staff need anything from the board in order to have the permission to put together the 4-pager or the case study, so to speak, so that that can be trumpeted and shared not only with our AOC colleagues, but the LOC and so forth, because there were so many incredible partnerships developed, the opioid funding from the cities, the whole engagement model. You could look into that. That'd be
Yeah, I think that's a great idea, and I actually think this is publishable in some of our public health journals as well. So it's an opportunity to share the success.
I see an
Absolutely.
ECO article in the works.
Yep.
Hopefully, is there anything else?
Yeah, a couple of things real quick. I was out of Cornelius yesterday while you were in the lunch meeting, and I walked right on by. I didn't know you were in there. I would have joined you, but
You were in the public safety one.
I was at with the Cornelius Booster Club for public safety, and then I also handed out flyers for the library. So we kind of covered both tonight, and I covered both of those in my comments. Last night, like Rick said, was at Forest Grove City Council with Clean Water Services. And then we have the annual housing forum coming up. So, yeah, I'm good.
Really, really interesting times. What's going on over here?
So last Wednesday, we had a community action board meeting where we conducted the executive director's review. So that's not public information, but did do that. I do think there's one thing that the board should know, though, just for general economic sort of knowledge. The entire organization of community action is going to, because of financial constraints, not be providing even any kind of COLA or wage increase for employees across the board. And that's just the reality of the situation they're in. And I think it's important for us to know about that. Last Thursday, I had lunch with Sherwood Mayor Rosner to talk through a number of things and catch up. That was good. Also had my briefing on the service level assessment tool, which was very helpful. And I think I shared I'm very impressed with where it's gotten to in usability and the available information. Friday morning, I did a live interview regarding the public safety levy on KATU. That was interesting and longer than normal live TV I've done. So then the cat ribbon cutting, which everybody's covered. I just was really impressed and thankful to all of you that were involved. And I got to basically show up at the tail end of this and celebrate it. So thank you all. Sunday, I met with Majority Leader Bowman and talked through a couple of issues and have some follow-up to do there. Monday, met with LUT leaders and a constituent about an ongoing challenge south of Sherwood on a county road. Maybe more to come in the future on that. We'll see. And had my one-on-one with the chair today. I'll be at the annual housing forum. Friday, I'm meeting with Tim Dooley from AOC, and I guess I just want to give you all a heads up that we're engaged. We're encouraged to get engaged in some sort of AOC work as part of our county college experience, and so I am going to engage on the public safety front with AOC, and we're just going to talk about what that involves. Also have a meeting with, oh, that's loud, with Lucy Hamer from Espousal to work or talk about the future planning for Acre and Acre work. And then Monday of next week, we're doing Public Safety Coordinating Council sort of initial member interviews that we will then, I think, bring recommendations on. So I'll be participating in those interviews along with Aaron and a couple of other folks. And then we also have Acre on Monday.
Yes.
So how many positions on public safety is
Interviewing for?
And the community members wanting to renew?
No, they're
Okay.
Yeah, I don't.
Okay. Okay.
That's all I got.
back on the AOC committees.
Yep.
Between our November 6th and our December 4th roundtables, we need to take a serious look at that.
Okay.
Because general governance and revenue is also another committee. I attended that as much as I could over the last couple of years. But that is where we, the county, offer a lot with assessors, A&T clerks, court comes up because of facilities. So we need to have that on our radar.
I'll go next. I had a great meeting this week with Fran Warren, and she really gave me a lot of good information about some of the work she's doing. She's working on trees on school campuses through Cool Schools program, and how she got a $300,000 from them to run the program in partnership with the state. So that was a really good, good meeting. And then I had, let me pull up my calendar. Yes, I agree. The CAT was really great. Great event, great organized, very well attended. In terms of other meetings that I've been involved in, last night there was about 130 people registered to attend Know Your Rights training that Representative Farah Chachi and myself organized and put together. And it was very well attended. I think our board, you know, I'm very disappointed in some of the updates I've heard today. None of you talked about what's happening in Washington County in regards to ICE raids and the impact it has on the communities. People are crying. People are not going to work. People are not sending their kids to schools, and people are not going to the grocery stores to eat. So they have nothing to eat, and none of us are sort of taking a leadership role in this issue and saying, what can I do and how can I be there for the community? And I think what is missing here is the knowledge base. And I wonder, and if this board could consider having two things: have a training for among us about know your rights and how you can get involved when there's an ICE situation, and how you can, as a resident, as a citizen, as a neighbor, how you can to participate to protect people from being snatched from the streets. We're not talking about open borders. We're talking about real people here in Washington County, people who've lived here for 30 years who are just accidentally being taken off the streets. And then we have to navigate how. So you have an opportunity to be a leader and to make a difference in Washington County. Yes, we're busy with our calendars. Yes, we're attending so many events, but at this moment, what the community of Washington County needs is your leadership, your presence, your sympathetic ear. And I don't see that from all of you. And it's really heartbreaking and disappointing that nobody's stepping forward about ICE, or nobody's saying anything. Community are listening, but they're saying, where's Washington County? What's Washington County is doing? And I think two people here is not enough. We need all of you to step up at this moment. This moment demands your leadership. This will go with your legacy. How you show up matters for people. And I think you have to recognize, and you have to know what's going on in Washington County. There's a problem, there's a trouble, there's a surge of ICE raids happening in Washington County. You cannot sit here not knowing that. It's been covered in the news. There's an opportunity for you to participate and show up your leadership tomorrow. There's a press conference happening about Victor Cruz, who was living in this county for 30 years and was taken accidentally because there was a different Victor that the agency was looking, or so. Regardless of the details of that story, there is an opportunity for you all, and I invite you all to show up for Victor Cruz and show up for the families of Washington County and be part of this. Attend Know Your Rights. You can make a difference. You can save a life. You can be helpful. You can. It's what's happening. It's unacceptable. And this is a really bad legacy. and we're not showing up people when it matters. So I commend you all. I urge you all to attend the press conference tomorrow for once. This board needs to have know your rights training, and this board needs to get more information about what is happening in terms of immigration rates in Washington County. Let's have that public dialogue, and let's talk about what we can do as a board. We're 5. This moment calls for our leadership. Yes, we are attending events and going to because it's part of our role and job, but you have to know that there's something bigger happening in Washington County.
Thank you, Commissioner Fye. Next, we will move on.
See, nothing is happening. You're moving on, Chair. You need to pause and reflect on what I said. This is not a good legacy for you, Chair.
Thank
Pause,
you, Commissioner
reflect.
Fye. Thank you, Commissioner Fye. We're done with the district member communication. We will turn to our final board communication item, and that is a draft letter for our consideration. Do we have a member of our LUT team? Because I'm not 100% sure that I brought my right copy of the letter. I'm afraid I brought the second version from yesterday versus today's version. So what I'm just trying to check is, I think today's version talked about the January 2027 date. So that's why on the second page, I think I don't have the right version.
Correct. For the record, Erin Wardell, Assistant Director of Land Use and Transportation. The only change that was made to the letter this morning was the effective date. We received written confirmation from DLCD that the staff recommendation would be January 1st, 2027. All of the written materials online still say January 1st, 2026. So we weren't comfortable moving forward until we received that. And that was the only change made this morning.
Okay, great. Beyond that, I know you guys don't tend to bold statements in your letters. And I agree with everything that's here. But the first paragraph, a few of the sentences, really, I thought, if they only read one thing. In the first paragraph, the second sentence, so the start at the end of the third line, additional time is needed prior to finalizing and implementing these rules. Bold that part.
Mm-hmm.
And then 3 lines up from the bottom of that paragraph, after additionally, we are unsure what the cost of implementing these rules will be, period.
Mm-hmm.
We cannot bear the burden of blah, 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 to the end of that sentence. Mm-hmm. Those are the 2 big messages from the board. All the other paragraphs, I think, deliver great information, and I hope they will embrace it all.
Yeah, I would hope they would read it for content, because there is a lot of good information.
Yeah, which is something I learned as a Metro counselor. Sometimes the best you can do is get them to see the bold statements. Yeah. So I just want to set ourselves up for as many wins as we can get them. The messaging.
And our requests on page 2 have bolded sections
Yeah.
too,
Yeah.
which I think are good, because I frankly think that may be some of the only part that gets read.
Yeah. Beyond that, are there any comments or questions? Thumbs up? Okay, terrific. Thank you very much. The only other thing I want to note is during board updates at the meeting, I checked yesterday, but not today, on the board calendar moving ahead, October 30th, the roundtable starts at 1 and not 9 a.m. So I will be making that correction verbally. That's all. Okay, so we'll see everyone back at 6:30 this evening. Thank you.